We're on.
All right. Okay, so the case study says Edith Stein is an 85-year-old woman who was admitted to the hospital with a diagnosis of mitral stenosis. Edith has been experiencing dizziness and lightheadedness and fell at home before admission. During the physical examination, the nurse notes a diastolic murmur heard best at the left sternal border and crackles in the lungs. Blood pressure is 130/80, pulse rate 88, respiratory rate 16. Edith is most concerned about her fall and the sensation of dizziness that has been progressing. Why would these symptoms be especially worrisome in a patient with mitral stenosis? And then get my answer out.
So this is all in the book on page 826.
Yes. Okay.
So basically her stenosis is getting worse.
Yeah.
Yes.
Is what I thought.
What I looked at was the complications of mitral stenosis, and so I wrote down all the possible complications, and then I tried to decipher which one it would be. So the first one was heart failure, pulmonary edema, pulmonary hypertension, atrial fib, and cardiomegaly.
Mm-hmm.
Okay.
And so then what I thought was because of the dizziness. Typically dizziness is a symptom of atrial fibrillation.
Mm-hmm.
So that's how I narrowed down which complication I thought it was.
Yeah, I put to monitor the heart rate to see if it was an AFib, and then to monitor the pulmonary pressure, and then she could have a decreased cardiac output, and then there's always a possibility of like her in the long run having a stroke.
Yes, that's what I put too. I put decreased cardiac output. Dizziness could be from decreased oxygenation due to the pulmonary congestion, or more serious as a TIA.
Yeah.
I think all of those things are good answers.
Mm-hmm.
The only thing I didn't look at was because the dizziness is progressing, which is why I thought atrial fibrillation, because typically you become more and more dizzy as your heart rate goes up. But it also could be if they have her on a diuretic, that could be affecting her and causing dizziness as well. So that is a cardiac case study, so that's probably not correct. But I would do a BMP and a cardiac enzymes just to check.
Mm-hmm.
Okay. Does anybody have anything else to add to that question?
No, I didn't have anything else for that one.
All right. Whenever a patient, what are some important preventative measures that should be included in this patient's education plan? And I said education related to signs and symptoms of bacterial endocarditis should be provided to Edith and possibly her family, which would include fever, inflammation, anorexia, malaise, lethargy, small petechial hemorrhages of the skin, nail beds, mucous membranes. I also said diarrhea, abdominal and flank pain. Those are the main ones that I put. And then
Prophylactic antibiotics.
Yep, prophylactic antibiotics, dental hygiene, and then I kind of talked about a little bit about blood thinners if that is the direction you needed to go.
I put that. I put anticoagulation therapy.
I had all of those things.
Oh,
Now,
yeah.
I also put down, like, just for mitral stenosis, you would want to discuss diuretics and the things to watch for that, like low potassium and those type of things. And then I wrote down about, like beta blockers and calcium channel blockers, which she's probably going to be on at discharge, because they can slow your heart rate, and so sometimes you have to monitor that. The other thing I think we need to check, or also reminder to do, is to check our blood pressure, because sometimes with dizziness, it can drop with, God, my mind just went blank. Orthostatics.
Oh, yeah.
So one of the things I thought of with the dizziness is it orthostatic or is it cardiac related?
But I think she should also check her heart rate too, along with blood pressure then.
Correct.
Right. Yes. Mm-hmm.
But when I went back and reread the questions, I thought maybe that wasn't what they wanted as far as education. Did they just want education for bacterial endocarditis or for mitral valve stenosis in general?
Okay. Do you, I probably will include a little, it's important both ways, I think. Especially, we don't know how new of a diagnosis this might be for her.
Yeah, exactly.
So I guess if we're including all that, we'll go ahead and include signs and symptoms of a stroke as well.
Yeah.
Okay. All right. Does anybody have anything else to add in there?
I don't know. Oh, you can't see it. Never mind. Oh, I might email this to you. I thought it was something we could put in the education. And so it shows a picture of a normal heart and then a picture of a mitral valve stenosis heart. So it kind of gives the patient a visual of mitral valve stenosis. I know when I worked in the cardiac department, a lot of times it was easier to show them versus explaining it. So I always did a lot of pictures.
Yeah, for sure. That would be great. Okay. Well, I think we've got all the questions pretty well covered. Can probably quit recording.